note from the teacher to be able to say that you can record. That's great, thank you. Do you want to pop all of those up? Yeah, that's great. Okay, so that's our agenda, Luke. As I say, we usually start off with one and we end up going through everything and then coming back round to the agenda again and saying, oh, we've already talked about that, but it's not a problem. Well, it might be a problem for Kate because she'll have to keep some notes of something about what we've been talking about. So do you want to click us onto the next slide, Kate? Does that say the student feedback on the portal? Yay!
Yes.
And are we able to get the portal up so we can have a look at it on screen?
Oh, I can find it, yes. Just give me a second.
I did have a look at it. It was probably around the time that we were going to the CQuake, which is the college quality meeting. So that was about 3 weeks ago. And there wasn't very much on there, but I don't know whether we'll have had more added to it subsequently, but it would be good to have a look at it live and see if there is anything.
So I'm just going to have to share a screen rather than sharing the files.
That's
Just bear
okay.
with me a second. So are you able to see that?
Lovely, thank you.
So if you wanted, there is a video available on how to use this, but if you wanted to check for, I'm going to do psychology because that's, oh, it's not there. So School of Computing Engineering, you can review this and see the feedback available, but there doesn't seem to be anything there.
Okay, so do you want to go to the college level? Because when I looked, there wasn't very much in there.
Yeah, it's coming up with science and engineering again.
Oh, there's definitely something in there for HPSC.
Just bear with me a second. So I wasn't. Hang on, I will see if I can access it from a different way. Just bear with me a second. Okay, so there is the sort of background version of it. It might just be that I'd not got access to it. So here is the database. And you can search it by program and things like that.
Can we get it in? Can we do it through college or not? Cheryl, is this something that you can access? Would that be?
I'll have a look to see if I have got access to it. I'm not sure I've been given permissions yet.
Okay, that's okay.
It might be worth perhaps starting with if anyone has actually started to use that, as the officers all know of other students that have used it and how they're finding the use of it, while we have a look to see if we can find any of the comments.
Well, I think we may have answered that first question, is that it doesn't seem to be going particularly well.
We have had a comment that is on one of the slides, a question. So it, but that was for specifically for this forum rather than from the feedback portal.
Okay. I know I've seen a link to it, but I can't remember how to get there now. Sorry.
If you go to this bit here in the SharePoint, and then go to staff, and then there should be one that says voice. No, not here. Oh my gosh. Oh, sorry, SharePoint.
Yeah.
There's one that says voice. Let me spot it.
Yeah.
Here. And then this takes you to this screen. And it should be accessible through here, but it's also accessible here. So this is where the database is. So everybody should be able to see this.
Yeah, I've got it now.
But it doesn't look like they've all put the college in.
Okay, I've got some.
Okay.
So do we want to go through these, or do we just want to talk about the use of the portal? Luke, what's most useful?
I think talking about the use of the portal is
Okay.
useful.
I don't think we're going to get through all of those. There's quite a few in there. So that would suggest that people have actually worked out how to use it now. Well, Charlie, Tony, Luke, use of the portal.
Yeah, so I've finally been able to log in, excuse me, and I've had a look. There's quite a lot of feedback on there, so it is a bit difficult to try and sort of pinpoint the trends and stuff. But I think once all the colleges are on there, it might be easier to kind of work it out. I don't know. I think I need to have a play around with it. But I do like it. I think it's a really good place to put all the feedback.
Yes, I agree. Tony, have you been on there at all?
I haven't been on there. I am aware of it, but I'm in a very strange situation as student rep where I haven't really had any feedback because I'm having a bit of a peaceful period with my cohort, which I'm not going to talk about too much. So there's not been anything really that I've had to take forward, sort of thing. So, but I know just from reps meetings that they're finding it quite helpful to have it all on the portal so they can pull it all together and get a bit of a richer picture kind of thing.
Yeah, good. Thank you. Luke, I can see that there are a few on there from forensic psych. So it's obviously working its way through.
Yeah, I would say I'm not sure if there is enough, I don't know how to phrase it. I'm not sure if people are aware of it enough.
Well, that was going to be my question is what can we do to advertise it, and what are the student officers and the reps doing to support it? Because I suppose you're the informed minority, really, aren't you? That you are aware of it and you've come to the forum today. So you know you're the people that are in that minority group in the college that actually do know about it and are engaging with that feedback and representative processes.
So the reps are the ones that can access this. So when they register as a rep, they then get linked with it automatically, and there's training on it through videos. So it's not available to every student at the moment. It's just something for the reps. Yeah.
Okay, that's helpful. Thanks, Kate.
That's okay.
So it sounds as though then what would be really useful is if, because we can access it as well, I suppose this is an action for Fran's here now, who's the head of Allied Health and Social Care. Do you want to just introduce yourself, Fran?
Yes, sorry I was late. I'm Fran Fuller, Interim Head of School for Allied Health and Social Care.
What would be useful, and I think is an action for the heads of school in particular, is to be putting a diary note in on a regular basis to go into the portal, because it's all very well information going in there, but if we don't do anything with it, then we're not closing that feedback loop, are we? So would that be a sensible thing for us to do? Charlie, do you want to come in?
So I think, if I'm correct, that when the feedback goes into there, it flags up to whoever is responsible for answering it, I think. So you should get a message if it's a college-wide issue or if it's a programme issue. And I think a lot of them on there at the moment are programme level. And I'm told that once it gets to programme level, they will discuss it. And if it needs to be elevated, then the status will change to raise it, I think, but I could be wrong.
Yeah.
Okay, Fran?
Yeah, that's really helpful actually, Charlie. And I was just going to suggest that maybe that we ask programme leaders to put in a diary opportunity as well to oversee it. And I think because programme leaders or stage leaders meet with programme reps, that may be a tool that they use to consider when they're meeting, to have a look at the feedback and the comments and concerns that are raised. But I've never received any emails as such from it, so I don't know if that's actually working or not.
So I think you can guess, Charlie, that by our reaction we're learning about it as well. Cheryl?
I believe that there's the new structure for the committees, and that there's a pre-meeting before the programme.
There is, yeah.
Committee meetings, and that meeting would be where programme leaders talk to the student reps about what is in the system. And then those that are identified as needing to go further would then to those programme committees and through those structures. And the college ones would be elevated through to other committees.
So I know we had a pre-meet, didn't we, Charlie, before the sea quake, and there was hardly anything in there. So things have obviously accelerated since then, as people have got more settled into that rep role. So that I think it's just as heads of school, it's useful to see what's coming through as well, though, isn't it? And keep an eye on things, even if it might be resolved at a programme level or answered at a programme level. Keeping an eye on things as a head of school is probably a useful thing. Okay. Is there anything else that anybody wanted to say about the student feedback on the portal? Or should we move on? Mike?
Just to say that I've managed to get onto the staff portal side of it, and I can now see some of the feedback that's been submitted.
Oh, great.
I was accessing it I was trying to access it via the student portal, and of course I've not been a student for a very long time, so don't have access to that bit. But there is a staff tab to access it through the staff from the staff side, so I can see programme level. There's nothing. It doesn't look like there's anything at college level that I've seen.
Okay. All right then. Good. Fran, is that a new hand?
Yeah, just a quick one. Is it possible to have some brief directions as how to access it that we can send round to the programmes?
There is a video available I can make sure is sent out to everybody. I thought it had already been sent out, but I will double check it and get it sent to everyone.
It may well have gone out, but I guess it might have got lost in the ether. That was all. So
yeah, I had
if you send it out.
Sorry, yeah, go on.
No, I was just going to say, if you send me the link, then I'll devise an email with the bullet points on it, so
okay,
staff are more likely to pick that up then.
Yeah.
And okay. Kate, I've just been into the staff bit, and I can only get cozy as well, so it's not just you. It's okay. So although there is HPSC stuff in there, then you can't see it through the screen that we were looking at. So okay, good. Should we move on to the next thing, which I think is course resources? So anybody want to start us off on course resources? How are you finding the new look Blackboard? I suppose if you weren't here last year, you don't know it's a new look Blackboard, but if how are you finding Blackboard?
I haven't had to really use it that much because we're not back in classes yet.
Oh, right.
But
Okay.
I know when I did start doing it, I didn't like it, but I think that's just because it's new and everything's in a different place and some things aren't there that used to be there. So I think it's just that, getting used to it.
It's just the right it's like when they change the television channels on the it just takes you ages to get used to it, doesn't it?
It does, yeah.
Tony or Luke, have you got anything that you wanted to add? You've been here, both of you, a little while, so you were in the same position.
Oh, do you want to go?
I haven't got really a lot to say. I mean, I haven't found that many issues. Same as Charlie, to be fair. It takes a little bit of use to getting used to the way the platform operates, but in itself, it's not been any major switch over stress, and I've not had any feedback about my cohort or anybody getting perplexed by it or anything. So,
okay. Luke, anything else?
Yeah, personally, I think it is better now than it was before.
Good.
So
well, I know it was well due an upgrade, and I think there's been a lot of work gone on into what the appearance of it is. But it's when it's different, isn't it? And you're used to click here, click there, click there. It just feels counterintuitive to have to actually read it again and work through it. Okay, let's move on from course resources then to communication and information, because I'm sure there are things that we've got plenty to talk about, and I want to make sure that we do get through the whole of the agenda. Charlie.
So yes, this has been quite a big issue, communication, people complaining about. It's to do with the COVID stuff. So the fact that we've gone back to normal, I think people are just concerned that there's not enough information being given now about what the rules are at the moment at the university. And they're not entirely sure why decisions about the balance between face-to-face and online are being made. And they would like to know, so they would like that communicated as to why maybe they have more online than they do face-to-face. Because I think we're being told that sometimes it's when you're in a bigger class, but actually if the students don't know that, they're comparing themselves to maybe smaller classes who can go in more often. And they feel like it's unfair that they're not getting the same. But I think it could help if it was communicated to them why the decisions were actually made that way.
Thanks, Charlie. That is something that we've also picked up and we've been concerned about. And because of the size of the programs that we operate, the majority of our programs are classed as large programs. But Cheryl, this is something perhaps that needs to go back into the centre. Would that be something that you could take back for us?
Yeah, I'm happy to talk to student comms about the communications that are going out and that transparency. I know that they're doing a lot of communications around the campaign of the steps out of COVID and the buses, but I think, yes, you're right, something around the decisions of that balance between face-to-face and online would be beneficial as well, so I'll speak to them about that.
Thanks. And just as a reminder, really, I mean, we can start to, because we're the College of Health, Psychology and Social Care, I think we have a number of students that are already twitchy, and we're starting to see that twitchiness increase again, and rightly so. And maybe not all of our student body appreciate the situation that we're in, but we can start to see nationally, so Northern Ireland are just going back to everybody should be home working, so there are a number of things that I think people are starting to get much more twitchy about. The numbers aren't falling, we're seeing lockdowns happening overseas, so I think it's probably a good time for us to be just putting some of that back into context around the teaching. I know that we're doing a lot around testing, and even the government is saying perhaps you should be testing before you go Christmas shopping now. So at least acknowledging that it hasn't gone away. Charlie, did you want to come back in?
Yeah, just to pick up on that point about the what you were saying about the testing. I was talking to the testing centre this morning about maybe if there's some way to kind of promote, you know, this free coffee thing that they're giving away. They've changed it now to not just free coffee or tea, but anything up to the value of a cup of coffee. And I'm just thinking, when you watch them at the door, they don't catch everybody. And I'm wondering what sort of role we can play in kind of just getting it out to everybody, because it's, you know, you only have to have 2 tests here and you get a free cup of coffee. And I actually said this morning, well, I might as well do that rather than doing them at home. I might as well do them when I come in, and then actually having a free coffee for that, something you're doing anyway, is quite good. So, and I don't think all students really do know about it.
Well, that sounds good. I think we've kind of felt in our college that there's information overload sometimes, and you pick and choose what you look at. And COVID is one of those things where what hasn't been said about COVID isn't worth saying, but actually, as we well know, it keeps evolving, and there's always something different going on. So you're absolutely right. Free coffee, or up to the value of free coffee. I mean, you could eat like a king for a week, couldn't you, really?
You could, and I think it kind of feeds into that, you know, everyone's worried. Well, if we're all doing this, if everybody's actually doing this, then actually that does reduce the risk of the spread. So I think, you know, everyone wants to be back to normal. Well, if we do this, we might then have some kind of chance of getting back to it. So I don't know whether promoting that sort of side where people are complaining about it and sort of saying, well, there is something we can do.
Yeah. And while we're on COVID, I suppose these questions particularly for Charlie and Tony. Obviously, we've had the announcement in the last week or so that it's mandatory vaccinations for NHS as well as social care. Have you heard any rumblings come back through about that from students at all?
Not from my end, to be honest with you, as yet. But I think a lot of it, to be fair, just listening at sort of, because we're nurses, we've been classed as key workers, so I think a lot of people have been able to pick up the vaccine anyway.
Yeah.
And a lot of my cohort have been quite keen to pick it up because they've been on the front line. They've dealt with the rough end of COVID kind of thing. So they've been quite keen to get themselves out there and vaccinated, so they're taking care of that.
Yeah. Charlie, what about your?
Yeah, that's the same for me. I haven't had anybody complaining about that. And I think, again, we all had our vaccines. I think the last ones were sort of July time. So we're not actually due for our booster ones until January, I don't think. So
okay.
Not sure whether it will come up.
We have had a couple of, I think they were mostly first years talking about this came as a bit of a surprise to them. Whereas we've always said that you'll need to get occupational health clearance. It's just that the advice that we're being given is going to obviously change around what you need to have to get occupational health clearance. So I would can I just put that on your radars? If you pick anything up, I think we'd be keen to know about it. Mike, did you want to come in?
Just so we had a placement hub meeting this morning, just to talk about how we would support the gathering of the information about the vaccination statuses. So it's we are looking at a process by which we'll be sending out to students to ask them about their vaccination status, so that we can then allocate the placement area appropriately. So just to keep that on your radar, hopefully that will be heading your way, hopefully in the next week or so.
Thanks, Mike. Fran?
Yeah, I think it's probably fair to raise the issue of the consideration of GDPR and also human rights issues around the direction from the government. And I know that that's a discussion going on in practice, and I'm sure that students have already raised it in SCS. Particularly
and that's been one of the challenges in universities.
Yeah. So just to sort of put it out there, really, in terms of for the students' perspective, that we are aware of those discussions and would welcome, I would welcome further discussion on that and how we can best support those students, because I don't want to see them isolated in a sense of them feeling not being able to have the vaccine for whatever reason. So I just think it's going to be a really hard balance, but I think it's one that we need to be mindful of and supportive of.
Yeah, I think there's a number of students like you've described that I don't have a problem with this. This is for my protection as well as my patients and service users' protection. Bring it on. And then I think there will naturally be people that are nervous about it, but there will also be people that can't be vaccinated for very valid reasons. So all I would say, this is this is emerging really quite quickly, so that things are going to change at pace, I would imagine. So just to make you aware of that. And I mean, I suppose just because you're in that student officer role, you'll end up possibly being a bit more aware of what's going on, because you might have some questions coming your way. But we're taking guidance from the NHS and Health Education England to make sure that we're doing whatever we can, and the Council of Deans for Health and Universities UK as well are also involved in it. So it's kind of a national position that we find ourselves in, but we need to contextualise it locally for Derby. Is there anything else on communication and information? No. Okay then, Kate, I think we're ready to move on to the next one. Online learning. And now we'll just say that the online student forum is happening at the same time as this one, Kate. And obviously, yeah, we have online students who are now part of the college, so they might feel a little bit conflicted as to which one they wanted to go to. Yeah. So the timing of that is a bit of a challenge for us, and obviously we've needed to put staff into both fora. Okay. So to have them at different times would be incredibly helpful. Okay. But thanks. So we've already mentioned the switch to online learning and the prevailing presence of online learning in our college. So I'm sure you've got something that you want to chip in about this one. Have you had any feedback at all from students? Because we have, but we've already talked about we thought we were going to have a bit more on campus, and we seem to be having a bit more online. Charlie, do you want to come in?
Yeah, so I think there's been a bit of a mixed bag with this. So some people are saying that the content of the online learning it's not as long as it would be if they were having lectures. So they're getting shorter videos, and plus they're pre-recorded, and some of them are from the previous year, so they're not freshly recorded because they've got students talking in it, but obviously it's not them. So I think some students are just a bit confused about why they're not getting as much. I think they're saying that actually it's gone online, they're not getting as long, and plus they can't ask questions. So I think they're struggling with that a little bit. And especially when the balance is wrong. So when they're online more than they are face to face, I think they feel like they're not getting good value for their money, I think.
Yeah, I mean, I will say that we went through a lot of training as the online switch happened, and the evidence suggests that you won't be as engaged for as long with a video as you would be in a live classroom event. So that will be the reason why they are shorter, but everything else we will pick up and take back in and ask those questions. Has that been the experience of other students, Tony, Luke?
It's kind of varied, I think, to be honest with you. I think we've been very lucky at Nursing in the way that they've developed some of the stuff. and there's been vast improvements from where we were last year, realistically. There is still the issue that I get the odd comment, it's not so bad because we're just going into a module that's kind of even between online and face-to-face stuff a little bit more. And sort of the benefits are starting to show themselves. Like I've had a lecture this morning that I've been into, and a lot of the discussion is about the fact, well, the lecture's recorded, you can go back and you can sort of reflect on that. So there are the benefits, that side of it. But we all cope with things differently, especially when it comes to online learning. I think that's the thing. So
thanks, Tony. Luke, did you want to add anything?
I haven't really heard much specifically about the online learning, but
Okay.
on the topic of people thinking, you know, the videos are too short, I've heard people say just in general that the lectures are too short, but also that last year they were too long. So, you know, I don't know if people are always going to complain about something, I guess.
Well, next year means that we get the Goldilocks moment where everything is just right.
Let's hope so.
But it'll perhaps be too late for you, Charlie, and you, Tony, but Luke, hang on in there. It's really helpful to have your feedback, and we will certainly take that back into the college, but also, I suppose, Cheryl, the university mix as well, because that being able to ask questions, I think, is a really important one. And of course, if you were in a live classroom, that's why you would have been there longer, because you would have had those question and answer sessions, and there would have been activities built into things. So I sincerely hope you didn't have somebody talking at you for 3 hours, because that in itself is not going to be a great experience. So it's that mix and variety of stuff. Tony, do you want to come back in?
I was just checking my microphone was still on, or I'd have been talking to myself. I think a lot of it's as you go through, confidence builds in sort of questioning in the online on Blackboard and that kind of thing, and getting those interactions. A bit of the difficult stuff is when you've got big groups.
Yeah.
So if you've got sort of under 100, you can sort of manage the chat and people can turn the microphones on and that kind of stuff. Whereas when you go beyond that, the chat gets silly busy, and there's not that facility to turn your microphone on so that you can ask a question and that kind of thing. So it depends a lot on what sort of size the lectures are and that kind of thing within Blackboard, I think.
Yeah, and I know in some of the nursing lectures there are 400 plus people in there, and that is really, really difficult.
Yeah, we're quite good at keeping the lecturers talking, I've got to be honest with you, but we're sort of into stage 3 now, so we're good at quizzing them and not letting them get away with it. So.
Yeah, good. Okay, we'll take that back in. Thank you. Okay, should we move on to the quality of teaching? I mean, I suppose we've started some of that, really, haven't we? Is it shorter and that ability to ask questions? Is there anything else that you want us to pick up or that you've had feedback about? Charlie?
So I'm quite sure this is being dealt with, but I thought I'll just mention it anyway. But I know on some of your programmes, there's been issues about lectures being cancelled. And it kind of feeds into that everything being online, but the students kind of feel like the quality of teaching has gone down because of that, that they are not really learning and they're not getting that student experience. So, you know, the peer-to-peer chats that you might have in between kind of lectures and things, if they're not on campus a lot, they feel that they are missing out on those little chances to get to know each other. So they feel like they're not actually, they don't even know who they're on their courses with. But I believe that has been raised and it is being dealt with.
Yeah, I'll bring Fran in if you want to answer that, Fran.
Oh.
Sorry, buttons weren't working. It has been raised, Charlie, at various meetings that I've been in at different levels of the university, and we are operating a tracker to try and make sure that lectures on campus aren't cancelled. So what I would do is invite you or anybody from student representative group to contact the programme leader to raise it with them initially, because I'd be quite concerned if they were being cancelled. If staff are off sick at short notice, we are still trying to operationalise that lecture, albeit it may be online, but with facilitators in the room, if you see what I mean, because most academics have got material on Blackboard that they use to coordinate their lecture on campus. So I know that in some situations we've had to try and get facilitators in the room, but use the work that is on Blackboard already. But I'd be really interested to know if we were still cancelling lectures.
Thanks, Fran. And just going back to that social interaction and that peer-to-peer, Charlie, it has come back in, absolutely. And certainly in nursing, I think they've been trying to identify times and spaces when people can just come and drop in, and not necessarily drop in, but come and have that informal chat, because that's where what we would call a lot of informal learning happens, that, you know, you're talking to somebody, and because you can hear it happening in the coffee bars when you're here, that people go, oh, that's what they meant by that, and that's really important. And we absolutely know that's been the thing that has dropped out, and it's really important. So we will pick that back up again about the informal and that social peer-to-peer, and actively look for opportunities for people to come along, even if it's only for a cup of coffee. But it does go back to kind of some of what Tony was saying, that actually some people are quite happy that they don't have to schlep into the university for 2 hours of lectures and schlep back out again. So there's lots of pluses and minuses, aren't there?
Yeah.
But we would want people to have that opportunity. I think that's been the big thing about the university experience, hasn't it? That you know, you're not there all of the time when you perhaps would have been. Anybody else got anything about the quality of teaching? No? Okay, should we move on to the curriculum content then? Anybody got anything they want to feedback about curriculum content? I mean, I have to say, in this college, largely a lot of what we have to do is dictated to us by the regulatory bodies and the accrediting bodies, so that we manage to get you over the line when we need to. But Charlie, come on in.
So I feel like I've been quite negative so far, so I'm going to give you some positives that I've had with relation to this, because I think what they have said is, when they've complained, my students have complained, they have actually said they are happy with the content that they're getting, so they're not disappointed with what they're being given, and they do feel like they are being prepared. I think it's just, you know, those are the little issues that are getting in the way, where they feel like maybe they're not getting those extra bits like the social side, and having that face-to-face. I think that's the main thing that they're missing, but the content they're happy with.
Thank you. Okay. Anybody else?
I've got to pretty much reinforce what Charlie said, to be honest with you, because I know it's been really interesting to sort of watch the journey with the students, kind of thing, because it tends to be sort of an annual feeling of being overwhelmed at the start of the year when you look at all the modules that are coming forward, but as you get into the modules, the content's been what's needed, kind of thing, and it's helped people get through. There's been some really rich learning, even though we've been in an online situation. So just as an example for us as nursing students, they've developed a virtual placement offer, which in itself, if you were new to nursing, it would have been quite an overwhelming period. but the lecturers and the whole lecturate team were really good at reinforcing the fact that this is stuff that you can take forward into practice and that kind of thing, and reassuring students that you don't need to remember all this information. This information will slowly sink in over the next however many years you're in your role thing. So yeah.
Thanks, Tony. It is challenging, and I think Mike was just saying it's a long time since he's been a student. It's a long time since many of us were sitting in a classroom. I won't say that we're not students, but that being new to a subject and that wave of stuff coming over you and you're thinking, how the heck am I going to cope with this? It's probably a little while since I was in that situation. Okay, let's move on to exams and assignments then. Always a knotty issue, because that's the payoff, is that you have to do that work to get through the course, unfortunately. So anything about exams or assignments? Good, let's move on. No. Let me tell you what we have done this year is that we have encouraged the programme leaders to, you know, when you've got a submission date, inevitably there will be people that need a second date. And for those people that have had exceptional extenuating circumstances, they may well need that third date as well. So what we've encouraged programme leaders to do is to get those dates into their own diaries so that they can make them available to students as well, just to help support your planning. I mean, hopefully the majority of students are going to at least try and submit at the first attempt. We have a number of students who've got support plans, and we have a number of students who quite rightly take advantage of the exceptional extenuating circumstances. But we would like to think that the majority of students are at least attempting to submit at that first opportunity. But just to help them and you plan, we've been encouraging them to get that there, and we've employed what we're calling life cycle coordinators in some of the discipline areas. So the life cycle coordinators are helping us with that planning and some of that organisation and management type stuff. Just because there's so much happening all of the time, and what we're aiming to do is to free up the academics to be able to devote that time to delivering that quality learning experience, and to ask other people to help with the administrative burden that is associated with that. And I think the more embroiled you get into how programs run, the more you realise how much admin actually goes on in the background. But Charlie, you wanted to come in.
Yeah, so I think some of the issues that I've had are people complaining about having to work on their assignments whilst they're still studying. So and I think this is a common issue, is that they're saying, you know, we haven't been covered all the content yet, but yet they're having to complete their assignments. So that sometimes can be a little bit difficult, that they haven't had that until the end, and their assignments are due sort of when they finish. So, but I don't know if there's much you can do about that, because it usually kind of coincides with Christmas, and obviously lecturers need to have their time off. So I don't really think there's much to do about it, but that's all I've got.
Well, we're constrained a little bit by the semesterized or trimesterized approach, that we have deadlines that we need to adhere to. But certainly that's something that we can take back in with life cycle coordinators, program leaders. I suppose it's for you, Mike, as well, managing that administrative function, because there's obviously a lot of registry activity that happens at the same time as there's any kind of submission date of an assignment. So to have it distributed slightly differently might be useful for all of us, but we will have planned for this year, but certainly it's something that we can take back in to talk about.
Sorry?
So carry on, Luke.
I was just going to say that I've I've heard some students saying that they felt the assignments were due too close to each other. But I feel like it's less of an issue that the assignments are due too close to each other. That in of itself isn't the issue. I think the real issue is not enough guidance on when you should be starting the assignments, right? Because it's like, you don't have to finish it, you know, a couple of days before it's due. You could, if you started it sooner, obviously you don't have to be doing all your assignments at the same time, is what I'm trying to say, if you pace them out. But
thanks. It's a really interesting observation, because what Charlie's described is that the assignment gets launched early on and people are saying, but we've not been taught the content. And you're describing, well, if it's launched early on, you can get a bit of a start on it and you don't need to leave it till the last minute. So this is, I mean, I've been in academia now 25 years. Can I tell you, this is always the same conversation that we've had, that you either, if you gave it to people later on when you've taught half the module, they'll be saying, you could have given this earlier, that we would have had more notice about it. But I think the bunching thing is a fair comment in terms of what does the student journey look like? That's certainly something that we've been focusing on. Fran, did you want to come in?
Yeah, I was just going to say that there is some method in the madness in some respect, because we're an applied, many of our programs are applied. It's about enabling students to devise strategies to cope with presenting information all at once. So we've, like Denise said, we have this feedback every year, to be fair, about clumping submission dates together, and we do try and move them as much as we can, but there is some element of enabling the student to be able to manage their workload in a way that they would have to manage their workload in practice. So there is some method in it.
Okay, so I was just about to say that when we get to the end of towards semester one, that's when I think the issues around exams and assignments will really start to flare up for us. I know that you've got some submission points coming up, and so things start to get a little bit more. People get a bit more vocal about that as those deadlines start to loom. I think one of the things that I would really appreciate your support with is submit it first time on time, because that's such an important message. And you know, we have come from we've come out of a period where we've just done all of the assessment boards from the end of last academic year, and the number of people that have found themselves, they've created a far worse bunching and clumping effect because they asked for an EEC earlier on in the year. Okay, so let us move on to placement and work experience. Always an interesting one in this college. You've already said about virtual placements and how we've had to be really innovative and bring those on. Luke, do you go on work experience as part of your programme, and does that happen now? Does it happen later?
Yeah, the spring of second year is when you have to do placement, or volunteering.
Yeah. So is that have you got that lined up?
Yeah, it's coming up.
Okay. Kate, did you want to come in?
Yeah, we did have a question from a student sent in for this. I think we've basically already covered it, but I need to read it out anyway. So there was a few students had raised concerns regarding occupational health screening and vaccinations prior to placement allocation. They're difficult to get a hold of as emails are forwarded more than once, the phone number isn't answered, and no voicemail facility. Also, no appointments to book any of these appointments, and students are becoming very anxious they won't get their placement.
Mike, this is your question. It's got your name written all over it.
I will certainly take that back to the manager of the OH service. Was it a specific group of students in terms of programme? Just wondering whether the anxiety is because they're due to go out on placement earlier, or
Unfortunately, I don't have that information.
Okay,
so
that's
the
no worries.
questions were received anonymously. So I've
Okay.
only got what was in the
Well,
message, I'm afraid.
it's already come across our desk, and Mike's
Yeah.
really actively managing it.
So I think so at the start of term, the vaccination or the inoculation clinics were running. There wasn't much take up, so we
Okay.
then advertised the booking system, which is the same as how you book your COVID vaccination. It's on SwiftQueue. We promoted that through Blackboard and got an incredible amount of take up, which then filled pretty much all of the slots up until Christmas, which is great because they're being accessed and they're being used. It's just all of the slots have been taken. I did have a meeting with the service yesterday, and they are looking at ways to try and free up more capacity within their team and to clear out more of the clinic so that they can put more sessions on. But I'll definitely feed that back through to the team.
Thanks, Mike. Charlie?
So I know this is more just specific to my programme, so occupational therapy, with the vaccines, but the Hep B vaccines. When we were sent the emails about booking in for them and we sent off our vaccine list, people were turning up for their vaccines and then being told they didn't need to have them. So there was some kind of disconnect between having all the information that they needed to know who needed to have the vaccine and then only giving those ones the appointments, and also the amount of time that you have to leave in between them. So some people were turning up early for them as well. So I think there needs to be a little bit more of a clear definition of when you have to have it, who needs to have them, and that when they turn up, the people who they're turning up to are aware of their vaccine status, because we did have to send them in. We had to get them from our GP and send them in, but it was as if they hadn't received that information.
Okay, we'll take that back to the Occy Health team. Just for your awareness, it's run by an external provider. So we contract that service out. So it's not it is a University of Derby service, but it's somebody else doing it on our behalf. So we'll pick that up with them as a provider. Okay, thank you. Okay, should we move on to Pat's? Oh, Charlie, do you want to come back in again?
Sorry, I just wanted to say, because obviously I'll be negative again, but that actually a lot of students are really, really, really happy that they've been given placements, because they have actually managed to find most students' placements this year, given what's been going on. So yeah,
thank you. And the credit where it's due to Mike and the team, to Jan Royal Fern, to the discipline leads and programme leaders. It has been a mammoth task. And the rug has been pulled from under our feet at very short notice, more than once, and they've worked incredibly hard to get that. So thanks ever so much for acknowledging that, Charlie. Okay, Pat's support.
So Denise, sorry, I can I just round off the previous item by just saying a massive thank you to the students, because I think they've been very patient and supportive as well. So I know that we're all in it together, but it's been really appreciated. So thank you.
Thanks. Do you want to move us on to the next slide, Kate? Okay, so anything on Pat's support, folks? Fran, you're not a student, but do come in.
Sorry, it was just a point of information really, because I don't know if the students are aware, but we're operating plans for supporting students that haven't been able to progress or have progressed but are carrying modules, and I think that most personal tutors have started to engage with students, but there are some students that aren't engaging back, and that's creating some difficulty in the data, enabling us to make sure that we're hitting every student, if you like, with the support that they're entitled to. So it was just a request really to find out if students have found that system difficult, and if they have, or they're not finding it as easy as they should be, that maybe they need to go back to their personal tutors or back to the registry. I know Mike's trying to oversee it as well. Sorry.
Yeah, Charlie, do you want to come in?
So I think sometimes with the personal academic tutor, people don't really know exactly what they're for. So I think that's an issue, is that students aren't really listening in the beginning when we're told what they are. I don't know if it needs reiterating after that first initial week, because we kind of forget with everything that we're given. So yeah, so I do know, because even sometimes I don't know what I'm supposed to take to them. But I will go and ask anybody anyway, whereas other students won't. So I'm not sure if there's something we can do.
Okay, so again, Cheryl, that's probably something that we might benefit from. That now's a good time to remind you what your PAT's for. Do you want to come in?
Yeah, there is a PAT tile on UDO that holds a lot of that information. So I'll talk to the student comms team about perhaps doing a focus on the information that sits under there to remind students and signpost them to that existing information.
Yeah, that would be really helpful. Thank you. And I suppose it's that first meeting that you might have with your PAT, you haven't really got your feet under the table properly, and it's as you become more experienced and you go through the system, by the time you get to Tony's stage, you probably got their inside leg measurement and phone number. Fran?
I suppose just equally, as by way of support from the academics perspective, we could be touching base with our personal tutees sort of fairly regularly earlier on. And I know that's been difficult over the last 18 months, but I think we've got systems in place now that should enable us to do that. So I think a message to go back to our academics as well, Denise.
Yeah, lovely. Thank you. Okay, and all too quickly we find ourselves at any other business. I'll start, if I may. I would just like to say thank you really to our student officers and all of our reps. I know that we haven't got many of them here, but just to say thank you, because it's a big task to take on, but it's such an important role to take on as well. And we will only get better at doing what we're doing if we work together. And so, Luke, I think you were quite late to the student officer party. So if you haven't already, I would suggest we put you in touch with Jose, who's head of the School of Psychology, because that's a useful contact for you to have and to reinforce. And I've said this to Charlie, there isn't a massive pot of money. And frankly, you've asked a bit too late because Charlie got there first. But there is a little bit of money if we want to do some engagement events. And if you think that there are things that it would benefit, we're such a large college that it's difficult to make sure that you include everybody. But if there are things that you think we need to be doing, that just helps to break down some of those barriers. This goes back to that. We're not on campus as much as we used to be. You know, when I was a head of school, I'd quite frequently have people, largely occupational therapy, I have to say, Charlie, knocking on the door, and we'd have some good conversations, and they managed to wheedle out quite a lot of money out of the OT team to do. It's when DOTS was really getting up and running. But we're very keen to help you support what you're doing, also whether it's societies or if there's particular issues that we want to address or events, so that we do get that visibility and that co-production, because that's so important for us. We know how you have to work in conjunction with patients or service users, and you get a much better result if you do that. So we know that if we work with our students, we will all have a better experience, and that's really what we're here to try and make sure that we do. So that was my any other business. Has anybody else got anything else they wanted to say?
I just want to say a thank you to all the lecturer team and everybody that's been in there in the background supporting us over the past 18 months, because I've been in rep meetings. I know how difficult it's been to listen to me waffling on and harassing people and that kind of thing. And I have fed back at every reps meeting. I can't believe how well it's turned around the learning opportunities.
Yeah.
The delivery of sort of things that we're getting now from where we were when we first went into lockdown. So you deserve a round of applause for getting that.
Thanks, Tony. I mean, I know that you're not backwards in coming forwards. It would be really good if we get the opportunity to get a piece of reflection from you and get that into one of the journals, because I think that the student's perspective about how things have happened and what's happened and the journey that we've all been on, I think would be useful a useful piece of reflection and discussion to get out there. Maybe not just immediately, but that, you know, when you've got towards the end of it, it would be great to do that. Particularly, I think, you know, you've been on a very interesting journey personally. I'm sure I saw your face yesterday on the National Nursing Support Worker Day.
Yes. I get into all sorts of different corners, and I have done since I come to university, to be honest, because I'm on the apprenticeship. I mean, I said to my nursing, my manager up back at Kingsway Hospital few weeks ago, is I get involved with this stuff because I'm an apprentice. My trust are paying me to go through the course, so every opportunity that gets thrown at me, then I'm going to grab that, because it's been 10 years I've been waiting to become a nurse, so let's make the most out of it. And
I would certainly say that you have, and it's I mean, it's really helpful to have the apprentice voice in this as well. That's something that we really do lack. We struggle to get apprentices coming through for this kind of engagement. So Kate, what's the next steps then? Are you going to write up some notes for us?
Yeah, I'll be feeding everything back into the portal. I've put links for the portal into the chat just in case anybody wants to watch the video about how to use it, and there is a link to the actual portal which may hopefully work a bit better than the one that I showed you. But yeah, I'll feed everything back into there and let you know.
Great. I think we've got some actions that we'll take away and get working on, but just to thank everybody for their engagement, and I'm sure we'll see you again in the not too distant, but you don't need to wait for these fora to come and have a conversation. So anytime that you think there's something that we need to know about, please do make sure that you say it, and we'll keep an eye on the portal as well. Okay, thanks everybody.
Thank you.
See you. Bye.
Bye.
Thanks everyone. Cheers.
Have a nice
Bye-bye.
Christmas.
Yeah, you too.
Yeah. Have a good one. See ya.
Bye. Cheryl, do you need to stop the recording?